while we were in the process of carefully proofing all those printed agendas you received, the most hilarious email arrived in my inbox. It read, "I have never felt less accomplished in my life than when I read the Digital Health Summit speaker bios." Joel, I have to credit that to Joel Rubin, my colleague. Well, he is spot on. The people convened in this room leave me in awe. And that is the perfect segue into this next session. These next Digital Health Crusaders are powerfully making massive impact in the field of digital health and wellness. And we are lucky enough to have Katie Couric here to lead this discussion, who in her own right has become a true healthcare influencer.
Hi, everyone. Good morning. Hi, how are you all? Good? Yeah? Having fun? Okay, good. Well, I'm very excited to moderate this panel this morning with two people I have so much respect for. And of course, we're going to be talking, as many people have on this stage, about the revolution in digital health. According to a recent survey by Deloitte, 42% of US consumers said they use digital tools to track health improvement goals in 2018. That's up from just 17% in 2013. So as you can see, people are taking advantage of things like artificial intelligence, biometrics, and other emerging technologies that are truly having a transformative effect on healthcare today. I think it's incredibly exciting. And two important figures from very different spaces in the digital healthcare revolution are here to talk about what's going on now and what's in store for the future. Shelley Ibach, she is president and CEO of Sleep Number. Sleep Number is on the cutting edge of using technology to improve health and wellness for millions of people. And an old friend of mine, Dr. Toby, a friend of longstanding, Dr. Toby Cosgrove, the former president and CEO of the Cleveland Clinic and the executive advisor to Google Cloud Healthcare. So please give them both a round of applause if you could. So, Toby, I want to start with you to kind of give us the overall impact of technology. I think you have been on the front lines for many years in healthcare, obviously, running the Cleveland Clinic and serving patients for years and years. What kinds of things are you seeing that just blow your mind when it comes to this transformation?
Well, one of the amazing things that's happening is the explosion in data that we're now seeing in healthcare. It is enormous. And that is started out with the electronic medical record, and now we can record it, and then it's just gone on to all kinds of things. For example, the total amount of data in healthcare now represents 1/3 of all the data in the world. And the total amount of data in healthcare now is doubling every 73 days. So this is a problem that we have to learn how to deal with, but it's also an enormous opportunity for us to begin to understand the causes of diseases and understand how we can better treat them and prevent them.
And we'll talk about sort of how you analyze and organize these reams and reams of healthcare data in a minute. But tell me, share with the audience, Toby, some of the things that you've told me about things like retinal scans and mole checks and all the things that we normally would go to a physician to screen or to check or to monitor, that now consumers can do themselves, because I think some of the things you told me about are really cool.
Well, machine learning has really taken a huge amounts of data and began to turn it into understanding of disease. One of the amazing examples is what has happened with a company called DeepMind in London, which has been able to take a retinal scan, and from that they can make 60 diagnoses, and they can also tell you your age, your sex, and your blood pressure just from looking at your eye. And this has enormous implications because every diabetic in the world is supposed to have a retinal scan every year, and there's not enough ophthalmologists in the world to manage that. And then there is the opportunity now to begin to look at moles, and just by looking at and confirming what a diagnosis was in multiple cases, millions of cases, you now can make a better diagnosis with looking at a mole from using machine learning than a dermatologist can do, and to tell whether it's a melanoma or not. So this is just the beginning of the use of all this data, which is, and couple it up with machine learning, which is enormous opportunity in healthcare.
Meanwhile, Shelley, obviously Sleep Number, I think, was a very early adapter of technology. And what makes you such a crusader for digital health and what it can do for the average person?
Well, to be a crusader means that you're forging the future. And you're forging the future in a way that adds value to consumers. It isn't, just, you have to go beyond research and inventions and actually move it into an innovation, meaning it's broadly relevant and useful and adds value to consumers' life. There's, such a proliferation. Consumers are faced with a proliferation of data today. Of data and digital tools that personalize and can give you information about absolutely everything. That's not always helpful because, not everything is of equal value, especially to the consumers. And it is really the innovators and, the various companies' responsibility to help distill and, help advise consumers with their healthcare. Doctors are still absolutely necessary, but now we have digital tools and capabilities to be able to provide value and help consumers with their health and wellness. When there's an increasing interest and engagement in that, but it needs to be done in a way that is adding value.
And how have you done it? Because I know people are surprised when they hear that Sleep Number is a 32-year-old company. But you guys really pivoted and became a technology company. People think, oh, is it mattresses? But you really consider yourself a technology company, don't you?
Absolutely. In 2012, we had the perceptual acuity to understand the potential of connected technology, and we began to invest heavily in it with the vision of having a company with a smart bed that would deliver enormous value to consumers. Today, we are a technology company focused on health and wellness, and we are a purpose-driven company. And our team is highly dedicated to improving the lives of individuals by individualizing their sleep experience. And we're doing that with our 360 smart beds that have and deliver to consumers life-changing sleep, and we've proven higher quality sleep with our beds.
And you got that technology. I don't know if people know about this, but I always think it's fascinating how you use the technology that is being used for premature babies. And those sensors, the doctors couldn't kind of get in there and interfere too much with these premature babies. So they had sensors that would monitor their vital signs, et cetera. And that's really the technology you all incorporated.
Yes, I met the founders of a startup in 2012 and began investing in the company, and then we acquired that company in 2015. And it was all with the intention of making the bed smart and being able to deliver proven quality sleep to consumers. Sleep is the CDC has identified sleep disorders as a epidemic for society. 1 out of 3 adults are not getting adequate quality or quantity of sleep, and so it's a significant issue. And sleep deprivation has been linked to diseases like type 2 diabetes, obesity, heart disease, and many other health-related diseases. So it's very important to not only get the right amount of sleep, but the right quality of sleep. And that's really where we come in with our 360 smart beds that all consumers need to do, sleepers need to do, is go to bed. The bed will read your biometrics and make adjustments to the firmness of the bed throughout the night to ensure that you achieve your highest quality sleep. And that matters. We've recently proven with our data an increase of 15 minutes of quality sleep every night, which is nearly 100 hours a year. based on utilizing our bed and the Sleep IQ technology.
Is sleep deprivation, Toby, something that you think the medical community is paying a lot more attention to than they once did? Because, I remember reading about sleep deprivation, doing stories about this, and, in terms of accidents, et cetera, probably a decade, maybe even 2 decades ago. And I feel like the medical community has really woken up and smelled the coffee. Is that true?
Yeah, well, it took us a long time. I mean, if you want to be a surgical intern or resident, that's a classic example of sleep deprivation.
Right.
But, clearly what is happening now is a new recognition of the importance of sleep, both the duration and the quality of sleep. And interestingly, it has been associated with a change in your inflammatory response and your immunology. And everybody knows that when you're tired, you're more apt to get a viral infection. And I think that is frankly related to the quality and the duration of sleep. And as Shelley points out, we've got now increasing understanding of the cardiac disease, obesity, diabetes. And one of the things that's looming right now, which is really very interesting, is the incidence of Alzheimer's disease. And whether or not that has been related to inflammation from sleep deprivation early on, that is now being manifest many years or decades later in the terms of Alzheimer's, which is an enormous issue for us going forward.
Right. You were talking about the ease that people can use sort of the sleep number technology, Shelley. And I've noticed that motivating people, all the tools in the world are only as good as the people who are actually using them. But part of your philosophy is to make it really a no-brainer, super easy, and you feel like that will remove the obstacle to usage, right?
Absolutely, and this is such an important area of innovation, especially right now as consumerism moves into, healthcare. For us to, for us as companies and innovators to not only come forward with the technology that informs, but also that takes action. Motivation is the #1 barrier to improved health and wellness. And we like to just remove that barrier by making sure that we're pulling it through with the product in a way that is completely effortless for consumers. So here at CES, we're unveiling our new Climate 360 Smart Bed. And we know through our research that 80% of individuals struggle with either being too hot or too cold at night. So this new Climate 360 bed is the first bed with advanced temperature technology that will understand your individual needs and adjust the heating, helping you fall asleep faster, and then adjust the cooling to ensure that you stay asleep throughout the night for the higher quality sleep. So that, along with the adjustable firmness, delivers that highest quality sleep. And you don't have to do anything except for go to bed. That's it. And that's not that hard.
And the temperature thing is the source of a lot of arguments between men and women, right?
We save marriages.
Yeah, you save marriages, so yeah.
We absolutely do. And we bring people back together in the bedroom. And, that's another whole stat that, too many people are sleeping apart because their bed is not providing them the individual comfort and support. That is so wrong. You absolutely need to have that intimacy and make sure that you're coming together.
So you're like a marriage counselor,
we are,
too.
Yeah.
Before I want to talk to Toby in a minute about organizing and analyzing so much data and how we can make sure it really results in better treatments and cures for a host of diseases. But before I ask him that, I want to ask you, Shelley, about this announcement you just made today about a collaboration, a partnership with the Mayo Clinic. Sorry, not the Cleveland Clinic, Toby. Yeah. But tell us about it.
No. We're so excited to announce, we just announced today an extensive collaboration with the Mayo Clinic and Sleep Number, and being able to, we anticipate being able to produce evidence-based solutions to advance sleep science and cardiovascular medicine, and we're really excited about what this means for the future. If you think about the ability today to partner with companies like Mayo Clinic and Sleep Number, taking all the clinical research and medical knowledge and combining that with the extensive consumer knowledge and technology that we have at Sleep Number, and bringing forth an evidence-based solution to improve one's overall sleep and health. We see this as the future and making significant impact in taking on big problems like sleep deprivation.
Yeah, let me just say that I think this is a great collaboration, and I would encourage all of you to do the same thing. Digital is now coming to healthcare. And we in healthcare don't manufacture things, we use your tools. So please, I would encourage you all to try and partner with healthcare providers. We need your technology desperately to begin to improve the quality of healthcare for people across the world.
And why, Toby, do you think a partnership for the Mayo Clinic, speaking as somebody who ran a huge institution like the Mayo Clinic, why a partnership would be valuable for them? How would it actually help them serve their patients? And, I know Shelley told me that they have so much information from consumers that the Mayo Clinic may not have access to. Yeah. So that's one way, right?
Yeah, I think there's two things. First of all, healthcare providers have an enormous amount of data, and you all have the technology, and we can partner with you to use that combination. I think innovation, frankly, happens at the borders of knowledge and capabilities. And you all have one capabilities, and we have another capabilities, and we need to come together as partners. Right. And this is a great example of that.
And you're a cardiovascular surgeon.
I used to be.
Well, you used to be, but and a damn good one, Toby. But why cardiology specifically? I'm just curious.
Well, it's interesting that the cardiac disease, interestingly, seems to be one of the problems that is associated with sleep deprivation and interrupted sleep. And we're now seeing arrhythmias, we're seeing heart failure, we're seeing increasing coronary artery disease, all associated increased incidence with sleep deprivation. And this is a whole new field that is opening up and being recognized. And at the end of the day, we have to move from treatment to prevention. And this is an opportunity to do that.
And how are you going to take all this data? Because, as a founder of Stand Up to Cancer, we're really interested in using this data to come up with ways to prevent, treat, and ultimately cure cancer. But there's so much of it. As you said, it doubles every 73 days. So how do you take all that data, organize it, and actually make it useful?
Yeah, well, I think you pointed out a good thing. The amount of data, just take the human genome, it has 3 billion base pairs in every human genome. That's kind of hard to keep in your mind. And ultimately, we're going to have a place to store this data. And I think we're increasingly headed to the cloud to store this data. And I think there's a nice opportunity once the data gets in the cloud for have interoperability, which we do not have now with the electronic medical record. So the cloud is a place to store it, sort it, and ultimately use the machine learning to begin to understand these huge data sets that are an enormous untapped capability for healthcare.
And that's one of the things you're working on at Google.
And that's one of the reasons that I'm working with Google Cloud, because I think that this is the opportunity to begin to manage the huge amounts of data that we have and begin to mine it for improving our capabilities.
And for us at Sleep Number, we collect over 10 billion biometric data points every night, and we distill that down to providing each one of our sleepers their specific sleep IQ score from the night before. My average, by the way, is 82. And we also give them their average heart rate and their average breathing rate, along with other insights for them to be able to ensure, that they understand how their daily activities are affecting their sleep at night. But the machine learning and the AI gives us the ability to take that 10 billion biometric data points and distill it down into useful information for the consumer, and then also take that longitudinal data and be able to, share and partner with the Mayo Clinic in the way that we are, and add even, greater value down the road.
I know you're worried, Shelley, and you don't feel like there's not enough attention paid to ensuring all the information that is available to consumers is in fact accurate.
Exactly.
And what can be done to help ensure that?
Well, I think part of it is having the conversation about it, because, you're hearing, everybody's talking about, data and the disruption in healthcare and the shift of consumerism and, data for the sake of data. But it doesn't mean that all data is equal. And, this is going to be an emerging area that's so important for consumers in the future. You have to be able to trust your source of data, and that means you need to trust the company it's coming from. And it is, the responsibility of companies to ensure that they're providing accurate data. But at the same time, I think for all of us using data, we need to vet that out and see, who are they partnering with? Are these credible sources? And this is where we've put, we've been investing significantly for many years now to ensure that accuracy and the privacy for individuals' data.
Not unlike the news business, really, right? Where you have to be a discerning
Exactly.
consumer and figure out what's,
Well,
that's a whole nother panel.
But I think that gets back to the point that you have to, the places you get your news, some of them are reliable places and some of them are not. And I think you have to do the same thing with healthcare. When you begin to look at where you're getting your information about healthcare, not all of the things that are on the web are reliable, but there are lots of places that you can go to get very reliable information from the web.
Are you worried, Toby, as more information is available to consumers? I feel I'm fairly sophisticated in my medical knowledge.
You're very sophisticated, I agree with that.
But I never went, I didn't go to med school, and most people didn't, and they're getting all this sometimes complicated medical information. And are you worried that it'll be too much information and they'll stop relying on doctors and people who can truly analyze and evaluate the kind of information they're getting?
I think increasingly you're going to have to turn to medical professionals to interpret the data for you, because it's just overwhelming, the amount of data that you're getting, and it's even overwhelming for physicians, and that's why we have increasing number of specialists and to do that. But there are going to be opportunities where people can get the information coming to them. More and more people are going to have access as we democratize healthcare and healthcare information. And then there are going to be complicated issues that you're going to have to go to a professional to help you sort out.
So in closing, what are you both excited about when it comes to the future? 10 years down the road, or even less, I guess, at the rate we're going. How do you see everything changing, or what areas do you think are going to be ripe for disruption?
Well, I'm really excited about the fact that, the shifts and the trends are focused on individualization and prevention, what I call going upstream, having tools and products and, companies like Sleep Number and the Sleep Number Smart Bed to be able to help you lead a healthier, higher quality life, not just physically, but mentally and spiritually. And then I'm really excited about, our partnership with our collaboration with the Mayo Clinic and what that means for the future. When you think about the ability to integrate, our data and the clinical research and medical profession along with a consumer product like the smart bed. These kinds of partnerships and partnering with like-minded companies are going to produce, powerful outcomes for consumers' well-being.
And what are you excited about and what are you worried about, Toby?
Well, I am very excited about the future, and more excited about the future than I ever have been in the past. And I see the opportunities to begin to move to prevention. Basically, we can't make healthcare better until we begin to prevent diseases, and that's going from all the social determinants of healthcare, which again is a whole different topic. We have got to figure out how we control the cost of healthcare across the world and across the United States. And that's going to be done by efficiency, and efficiency is going to be partnering with a lot of people in this room to help understand the data and bring higher quality prevention and ultimately health care to patients.
Is there anything that you're concerned about as you look into the future?
Yeah, I think that the biggest concern that we have is the cost of healthcare, quite frankly. And you got two factors that are enormous driving the cost up. One, people are living longer, and two, there's more things we can do for people. 50 years ago, we didn't have hip replacements and transplants and cancer cures. And each one of those costed money. And so we have got to figure out how we prevent these diseases and deliver a more efficient healthcare in the future.
And Toby, I love that because it does. It leads right back to prevention. One of the greatest things we can do to control cost of healthcare is prevention. And that's where, companies like consumer product companies like Sleep Numbers and others can help, in that area, which ultimately reduces healthcare costs.
Well, Toby Cosgrove and Shelley Eibach, thank you both so much.
My
really
pleasure.
interesting
Great.
conversation.
Sleep well and dream big, everyone.